Hi, my name is Rebecca. I'm going to be performing how to remove a Foley catheter today. And so when I first walk into the room, I'm going to perform hand hygiene for 15 seconds like I would any other time. And so now I can go ahead, I can introduce myself to the patient. Hi, my name is Rebecca. I'm a student nurse at MSU. I'm part of your care team, and could you tell me your name and date of birth, please? And they're going to tell me that information, and I'm going to check that against their wristband. So you can go ahead. Everything matches out. It matches out on their MAR, on their DocuCare, and so we're going to make everything seems to be fine. Looking into the room, assessing, and so right away I'm going to explain the procedure to the patient. I'm going to answer any questions that he or she may have. In this case, it's a she. So we're going to be removing your Foley catheter today. We're going to start out with some peri-care. We're going to wash down on your genital area, and so then we're going to actually remove the catheter. And by that time, we should be all ready. Then you should be all done, and hopefully then you'll probably be able to get out soon. So right ahead. If my healthcare provider wanted me to take a urine sample, which it would have been provided in my notes, I would have. And so what I'm going to do is I'm going to perform hand hygiene. Once again, before I don my gloves, because just in case, don't want urine everywhere once I empty the catheter bag. And so I'm going to have a graduated cylinder for this. I'm going to have gloves, and I'm going to have my urinary bag. So I'm going to go. My gloves fell out. All right, this is a clean procedure, so I can go ahead. And while I'm doing this, I'm going to be looking for any kinking in the tubing. Make sure that everything is flowing freely, that there's no obstructions of any kind. And so I have my collection container with little measurements on the side so I can measure how everything is. And everything appears to be fine. I'm not seeing anything that could be wrong with the catheter bag, so I'm going to bend down. And that way, so that you guys can see what I'm doing, when I look at my catheter bag, I'm going to make sure, I would never raise it like this. I don't want to get urine backflow, but just so that you can see in the video. We're going to kind of look at it, make sure that everything's fine, that there's no, any kind of hematuria in there. There's no blood, no discoloration, that should be a proper amount in there. I said before that my patient had some urinary retention, so there should be a little bit of a larger amount of urine in there. So I can go ahead, what I would do if on the ground, of course, I would go ahead, put my collection cup underneath, unplug my little plug here. So then I would go ahead, and I'm going to go down on here, and I'm going to drain the urine into the cup, but of course on the floor below the patient. But you can't see me when I do that, so I'm going to do it up here. So I would go ahead, and I would return that, and I would measure it. I would look for any kind of discoloration, any kind of abnormal signs in their urine, and I would document whatever I found. So I can report that. If I see anything immediately wrong, I can go ahead and tell the healthcare provider about that. So I'm going to go and put this in the bathroom or dispose of it. So now we can go ahead, we can cover our patient back up, and I would discard my gloves, throw them away, and I would perform hand hygiene once again. All right, so my next step is going to be peri-care. So I'm going to lift the patient up to a workable height, and I'm going to once again make sure that my curtain is closed to provide privacy for the patient. Don't want to make them feel exposed or awkward or uncomfortable in any way. So I can go ahead, I'm just going to right away put my bath blanket on there. On him, and before I put my gloves on, I'm going to perform hand hygiene. So I'm going to perform hand hygiene for 15 seconds, just like I've been doing before. All right, so now I can go ahead and don my gloves. And at this point, now that I have my gloves on, I can go ahead and roll my patient's blankets down. to expose all the workable areas that I need to work with right now. All right, and because it's a female, we're going to have her legs as such. And I never had a leg strap before. Never had one provided for me. So I can go ahead. So in reality, there would have been a leg strap here, and I would have had everything labeled accordingly. And so I can go ahead. I'm going to lay down a towel just in case of any kind of possible secretions that could happen. All right. You can see me good. All right, I'm going to lay my pad down. All right, now we can go ahead and start with the peri-care. So I have my basin full of warm water already, and I have my washcloths and my other towel. So I'm going to have one washcloth for rinsing, one for actually washing. So I'm going to start out washing. Go ahead. We're going to start with her thighs and clean. Go to a different part of the washcloth. Go ahead. All right, now we're going to go ahead and rinse her off a little bit. So thighs once again. Different part of the washcloth. All right. So we have our washing washcloth again. Now we're going to clean our peri area. We're going to keep hold of the catheter, make sure that we don't yank it out, don't cause any problems. And so we're going to go ahead and clean the labia majora. Clean that. Find a different spot. I'm going to clean the labia minora. And if we need to, depending on how soiled she is, we could possibly have to change washcloths in between this. It just really depends on the situation at hand. So now we can go ahead. We're going to go down once more down the middle, just around the catheter. And we're going to provide catheter care. So we're going to take the hold of the catheter with the washcloth, kind of cleaning it, but we're going to support it with our hands so that way we don't yank it out. We're going to clean down the length of it. Make sure that it's clean. All right. So we can go ahead. We can get rid of that. Now we can take our rinsing washcloth once again. We can clean. Rinse off the peri area, so different spot. And rinse it off again if we need to. And same thing like we did before with washing, but we're just rinsing that this time. So now we can go ahead and pat her dry with our towel. That we don't prevent any skin irritations or cause any kind of infections, like any yeast infections or anything that could, bacteria that could grow there. All right, so now she's all clean and dry. So now we can go ahead. We can get rid of our linen into the linen hamper. We can get rid of our bath basin while we're at it. And so I can take out all the materials I had underneath her. And I can go ahead and get rid of any of those as well. I'm going to reuse my towel for the removal. I would have in real life get a new towel. What I meant was reuse my towel for the video purposes. All right, so once we've disposed of all of our equipment, I can go ahead, take my gloves off. We already had a urine sample, so I'll go ahead and move that out of your way. So I dispose of my gloves, and right away I'm going to perform hand hygiene right afterwards. And if she feels any pain or any discomfort, I could assess her, make sure that everything is going good, and if need be, I would, if she started feeling completely agonizing pain, I'd probably have to stop the procedure and inform the healthcare provider that she is on a 9 out of 10 scale of pain. So I can go ahead. We're going to actually remove the catheter. So before I would have checked my healthcare provider's order once again, and I'm going to have my syringe to deflate the balloon inside of her. And so for this procedure, I'm going to don another pair of clean gloves. So I've washed my hands. I'm going to go ahead and put clean gloves on. Brand new pair. All right, while I'm doing this, I could have, when I was providing peri-care, I can assess her abdomen, I can assess her peri area, make sure that everything is in good condition and that there's nothing going on abnormally down there. All right, so I'm going to go ahead, I'm going to lay my brand new towel down, just in case of any possible secretions that could happen after the removal. All right, so I can go ahead, I've checked my order, I've put in, before I put in 5 milliliters, it checks out, so I'm going to withdraw 5 milliliters of fluid. So with this hand, I'm going to stabilize the catheter. I'm going to hook it up to the thing, and I'm going to withdraw the proper amount of fluid, which I have done. And now it should pull right out, and it does. So I'm going to take that, wrap it in the towel. I can dispose of that, dispose of all my tubing, all of my, and get rid of everything. So now that we're all done with this, I've disposed of this now. All right, I'm going to, if she needs any additional peri-care, like any kind of freshening up, maybe I could do that. And I'm going to take off my gloves. Perform hand hygiene. I'm going to perform hand hygiene, and I'm going to get her back situated the way she was before, comfortable, and sitting happily in her bed. So I can go ahead, put her legs back down, roll her blankets and sheets back up, and remove the bath blanket, and I can go ahead and dispose of this into the laundry hamper. All right. So I'm going to provide patient safety, so I'm going to, I can open the curtain, I am going to put the bed back down, I'm going to push against it, make sure that it's fully locked, and it's fine. I'm going to make sure that her call light is in reach and that she knows to use it when she needs to, and that it's not a bother to any of us that she needs to use it. All right, so now I can go ahead, I can teach the patient. So after we remove the catheter, we're going to need her to, I'm going to have to be present while she urinates for the first time. That way we can record the time, how much urine came out, if there's any discoloration, anything that went on with that at all. So she understands. She knows to come call us and come get me, so that way I can assess her urination. And so I go ahead if she needs anything additionally, if she has any problems, any kind of urinary tract infection beginning, anything that could go wrong, she's going to come and tell me, and I'm going to help rectify the situation. So before I leave, I can bring all of her personal items back into reach where she can get them. I've just performed my safety, and everything is safe. The curtain's open again. She can have visitors if allowed. And so before I leave, I'm going to document my findings, if anything went wrong, how the patient tolerated it, any complications, and the time and date of the procedure. So now I can go ahead, before I leave the room, I'm going to perform hand hygiene one last time, and I'm going to ask if she needs anything before I leave. If not, I'll be back to check on you in an hour or two, depending on the situation. So